And then you should, I think, get a prompt on your own computer. And then I'm going to go ahead and share the presentation. So I will actually drop it in the chat and then I will screen share. Um, is everybody here today? And you can use the chat as well. Pre-med, or do we have some other pre-health students as well? Mostly pre-med. Pre-dental, love it. Okay, cool. Awesome. And sophomores, obviously, which is exciting. You're officially not a first year student anymore, so that's awesome. But then it kind of starts feeling a little bit serious, right? Like we really we got to get down to business. But no, you still have plenty of time. And we'll talk about that today. So I'm going to take the screen share and I'm going to present on Canva. So, Ilham, can you just give me a thumbs up if you can see that? Awesome. Okay. So, if at any point you can't see what I'm showing you or can't hear me, just let me know. So today is a pre-health sophomore check-in. So, whether you're pre-med, pre-dental, or still kind of deciding, there will be relevant information that we'll kind of go over today. And we're also, since you're sophomores, we're going to make it a little bit interactive. So anytime you see a little brain person on your screen, we'll open it up for questions. So really, you're able to ask questions throughout. It can be specific to you. It can be more broad-based questions. We're really open. We're a nice small group today, so I think it's helpful when we do speak up and share because probably someone in this group has the same question as you, a similar one, so we can help get all of those answers. So here's some of the stuff we're going to go over today. So just as a quick reminder, our health professions team, myself and Cindy Seltzer work as pre-med, pre-health advisors. We are temporarily in the mods. So if you didn't know that, we are in the green modulars. That's where I am right now. That's why the lighting's a little weird. But we are over here, so you can come visit us. So we'll be back in Green Hall hopefully next year. But for now, we are in the mods. And then we have three peer career mentors that do advising for us. And so Ilham is here today. And I actually have a link in that QR code to her Google Calendar, and I'll let her in a moment tell you how to schedule with her and what that looks like. But you can schedule one-on-one advising appointments with Cindy and myself. I know a lot of you have done that, but also you can schedule with our students, and I think that can be really helpful for getting advice on classes they've taken and the order of the classes and why, internships they've had, professors they've liked or not, So there, I think a student perspective can be really helpful. And so these are open throughout the year as well. So Ilham, do you want to talk a little bit about how to schedule with you and how that looks?
Yeah, so the link, the QR code should lead you straight to my Google Calendar, and there's a bunch of times and dates that you can schedule meetings with me. And if none of those work, shoot me an email and we can find something that does work.
Awesome. Okay, and the other reminder I just want to give you is to make sure that you're signed up for our newsletter. So it's not a one-click sign up, so that's why there's this kind of confusing screenshot. Happy to walk through it with you in an advising meeting, but basically you do have to opt into newsletters on Handshake, and it's under your name. Scroll down to career interests, and then you can subscribe to the newsletter. Those are important because I'm saying those because you can do more than one, but if you just do health professions, that's great too. But anytime City, myself, any of us get information on programs going on in Boston, internships, jobs, you name it. We put it in that once a month for you all to kind of get to your inbox. So definitely sign up for that if you have not done that yet. We can also pub an event for you. So if you are like part of one of the pre-med, pre-dental societies and you want to share something you have upcoming, you can email it to us and we can put it in the newsletter as well. And then one more program we have coming up. Anybody on this call do upskill last year, the medical professions track?
I did it.
Yay! So Taylor did it. So if you haven't done this, we've only had it for a year. So if you didn't do it last year, we're doing it again this year, and we were going to run it every year. So If you don't do it this year, you can also do it next year. But the reason I wanted to show it today is because we've kind of pushed up the application cycle. So you apply actually at the end of September, so it's soon. That starts tomorrow. And this is a program where you come back early from the January winter session. You come back early in January, like the 12th or 13th, and you take part in this 4-day hands-on skills training at Harvard Medical School with their med science program. And it's a really nice experience to just try. So, oh, Taylor, you're in that picture. To try some. Um, to try some different skills around like what you would be doing as a doctor or nurse or PA. Taylor, any like thoughts on if you like how you felt about the program, your experience?
It was like really amazing. I highly recommend it. It was really cool. We got to like have like pretend patients and we got to like diagnose and treat them. And we also got to do like skills. We got to deliver babies. It was a lot of fun.
Yep, and it's open to all years. We only take about 20 students, so if it's and we get a lot of applications. So definitely, put the time into your application, and if you don't happen to not get into the program this year, you could do it next year or senior year too. Um, Questions about the upskill program? Awesome. And then I added another event that you might be interested in. So if you haven't heard of the Med School Virtual Fair, this takes place in October. So the AAMC is the national organization for like med school. So if you're pre-dental, this doesn't apply to you directly. But if you're pre-med, this is it's a free program. You register, I put the QR code for a registration link, but you could also just Google it. And you're able to go to information sessions from different medical schools, and you can meet with medical school admissions teams. So if you have like a very specific question about a medical school, or someone was asking me the other day about like a pass-fail medical school versus a grade medical school and like what they should be looking at and why. That is such a good question for a med school admissions folks and in terms of like why and how they run their curriculum. And this is designed for pre-med, so they expect you to kind of be there and ask any kind of question. So if you are available to pop in, I would encourage you to register and take part in this experience as well. So we've got some good stuff coming up, right? Oh, look, I put and then this is a share. I have one of our Wellesley seniors started a really cool volunteer project and she's looking for help. So essentially they're using a 3D printer to make medical devices to send to Ukraine. So um, there's an email at the bottom here if you want to get involved. They're just looking for more volunteers. So that we'll talk about today, like getting volunteer experience on your resume and for your application for medical school. And obviously giving back to people in need is a great thing to do as part of that. So if you are interested in that, scoop up that email, reach out, and they're happy to train you on that as well. Stop me if you have questions. So that was just some kind of like upcoming things, some things I wanted to highlight for you. I did put the link to this presentation in the chat, but I'll do it again at the end in case you logged on after I added that link because I know sometimes you can't see the what's in the chat. So I can do that again momentarily. But for now, those are some upcoming things I would encourage you to think about taking part in. So from here, I'm going to let Ilham take it over and talk a little bit about an academics and academic check-in.
Yeah, so for some, like I guess an academic overview, some courses that are expected of pre-health students, specifically pre-med in this context, are you need 2 semesters of biology with lab, Gen Chem, so Chem at Wellesley, that would be Chem 105 and Chem 205 with lab, and then 2 semesters of organic chemistry. Physics, specifically Physics 104 and 106 at Wellesley, not Physics 100, which does not count for as a pre-med prereq. Math, Psych and Soc, and then an English writing intensive course, and then 1 semester of biochemistry and some upper level biology for some schools and also dental school. And then if you are interested in being a PA or nursing programs, You should also look into anatomy and physiology courses. And also, for whatever programs that you're specifically interested in, look up those programs' requirements because they might be a bit different from what the general programs are. And generally speaking, you should always prioritize your GPA for anything that you're doing, whether you're pre-med, pre-dental, all the pre's. A GPA of 3.5 or higher is recommended. And so here on the right, we have the averages. And so in the dark orange, it's the Wellesley average, and then the light orange is the national average. And these are just the that GPAs that students tend to get in to med school with. So we have our cumulative and then science and non-science. So aiming for around that 3.5 or higher should be your goal. Sorry about that. So, when you should have all of your pre-med courses complete really depends on when you choose to apply to medical school. So if you're planning on going straight through, um, no gap years, then you really want to have your prereqs done by junior year and then also your MCAT. But if you're planning on taking one or a few gap years, you can when you have all your prereqs done might be a bit different. Any specific questions related to um, academics and prerequisites?
Yeah. So we can pause there and anybody have any academic questions or course questions? I can't see the chat, so let me see. You can
Yeah.
also drop stuff in the chat. Go ahead. What was that?
Oh,
So
I was
go ahead.
yeah. Okay. If you have specific questions, you can also chat to us privately.
Yeah, definitely. Yeah, so sophomore year, you're kind of still in the process of your pre-med classes. It is important. So Ilham mentioned like people ask a lot, when am I supposed to be done with my pre-med classes? Well, it really depends on when you apply to med school, right? Or dental school. If you do want to try to go direct, which means no gap time between undergrad and your med or dental school, then you do have to have all your pre-med requirements done by your junior year. So you kind of squeezes everything in a little bit. Um, yeah, so we'll kind of leave it there. And then just note, like, again, I know we have at least one dental person on the call. A lot of dental schools do require an upper level bio class. They may require some additional coursework depending. So we always tell you to check program specific requirements, which are pretty easy to find online, or we can help walk you through in a conversation in an advising appointment. Okay, so who here plans to take gap time? Drop it in the chat. Are we thinking gap time? So just as you're thinking about, yes, okay, so perfect. So as you're thinking about, so what's gap time? Gap time is your time between undergrad and medical or dental school or PA school. So it's very common. I'm seeing yeses in the chat, which is great. So the most common amount of gap time is 2 years, but people take 1 year, people take 3 years, people take more than 3 years. So it's really open to you in terms of what you want to do. And gap time can be beneficial for a lot of reasons. And I have had the question before. Do medical school admissions like look down on people taking gap time? And that's absolutely no. They actually like it usually when you take gap time because what you're doing in your gap time is you're getting more experience, right? And you're gaining different skills and knowledge based on kind of like what you're doing. So gap time can really help you, but it's all dependent on your timeline. So if you're someone who wants to go straight through as well, we're happy to help support you along that way. Um, this is some data on Wellesley applicants and gap time. So this is applicants, this is acceptances. You can see they look really similar. You can see the largest amount of students take 2 years. Well, this is last year, so it's slightly different each year, but the pie chart looks about the same. Followed by 1 and 3 gap years, and then some take more than that as well. And if you can actually Google like national numbers as well, and it's very similar. So, since you're sophomores, you might start thinking about like, what am I going to do in my gap time? Like, I have no idea. There are so many options. I actually have like a whole presentation on gap time and what you could do. So I just wanted to give you like a couple examples of things you might have not thought of. Before we get too far into these, it's very common for people to do things like take a research position. So, any kind of research, but some of our applicants will find themselves really enjoying clinical research or health-based research, and find a two-year position doing that. Another common route is to do something in clinical work. So if you want more patient-facing hours, if you're interested more in that, you can think about getting like a certification to do that, either an EMT certification, or a medical assistant certification, or there's lots of others kind of like entry level medical certifications where you're able to provide direct patient care independently, but you're underneath a doctor or a medical team. So people will do that during their gap time commonly too. So some other examples here. So this is Emma. I don't know if any of you know her. She's a couple years out now, but so she did a program called MedServe. You can, again, this is very easily Googleable if you want to look it up, but this is a program for people in their gap time, which is very cool. And she specifically did a lot of health coaching, and working in community public health, with a lot of emphasis on her interactions with patients. So that was great to have on her med school application, and she really enjoyed her experience. So that is an option. This is actually an international student because I know we get questions from international students. Juliana, who did research, and she gives some kind of tips around um, what she did as an international student. But like I said, two-year research positions tend to be really common. And so she was able to find one, and really enjoy her time working um, in cancer research during her gap time. And then this is Stephanie, and Stephanie actually took a slightly different route to teach biology. So she spent the 2 years back at her middle high school that she actually attended when growing up, and decided to teach classes to those students while she was in her gap time. So I could go on and on. There's so many options, but as you think about gap time, these are conversations we're happy to have with you, and kind of plan out what you think might make the most sense. One of the things you can do to be strategic about your application is think about once you get to your, junior, senior year, like what are all the extracurricular experiences I have? And then what am I lacking, right? And maybe you do some of that in your gap time. Like if you really haven't done a lot of research, maybe you focus on that in your gap time, or, the other way around, you could do clinical work in your gap time, or maybe you're just following your passion and you find a really cool job in your gap time as well. So lots of options there. But does anyone have questions about gap time or been thinking about gap time at this point? I know we're in the awkward Zoom room, but you are welcome to speak up. Yeah, so we had a question in the chat about gap year and research, and kind of be literature review based. Absolutely. So research really, med schools are looking for you to have some kind of research experience. They're not really strict on what type of research experience, unless you're, pursuing an MD, PhD, or you're really like wanting to emphasize your research in medical school. But otherwise, they really just want you to have research experience so that they know you understand the scientific process. You are able to read research articles and apply the most recent research to your clinical work, right? So all of that stuff's really important. So they do want you to have that baseline. But as long as you really care about the research, you find it really interesting, you can talk and write about it, which comes in for the application, then you can kind of choose what that looks like for you. And it can be public health based. It can really be anything. We've had people do research in women's health, anything, really anything. So yes, you can, yes to the chat questions about kind of like varying your research in different areas. It doesn't need to be wet lab research, bench research, anything like that. It's really important throughout like this whole process, and we'll talk a little bit about extracurriculars, but that you really follow like the things that you really care and are passionate about. And it's hard to like say that as an advisor because it sounds kind of like cheesy, right? Like follow your passion. But what I mean by that is when you get to filling out your med school application, you have to present a story to them about who you are and why you're going into medical or dental school. And it's much easier to do that if you really have done things along the way that you really truly enjoy. That really comes through an application. And as a reader on our end, it's you can tell the difference when someone's like really invested in the volunteer work they're doing, in the leadership work they're doing, in the sport they're playing, in whatever it is. So that's it is an integral piece of this whole process. Okay. So as we look at this, this is good timing. So as we look at this slide on comparison is the thief of joy and how life is supposed to go versus how it actually goes. And this is exactly what happened with me. So I can tell you that that is the case. I got a question about publishing research. So do med schools want applicants to have published research papers? Um, the answer is it's an add-on. It looks good. Do you have to have it? Absolutely no. So I would say most applicants that we look at going into the medical school cycle, which is about 50 to 70 a year, most people don't have published research. But of course, if you have published research and you're able to put the application, that's definitely going to look good. But I think medical schools are aware, as you all are aware, that you part of being published is kind of when you enter a research project, right? Or what part you take, which is somewhat out of your control. So they know that as well. So if you are lucky enough to be part of a project that publishes, that's awesome. If you're not, it's really okay, not a big deal. But if you're someone that is in a research lab and kind of wanting to talk to your PI or your supervisor about being on a project, or I can definitely like talk you through that in an advising meeting, like how to talk to them about like I'd really love to be published. Like, is there anything else I can help with? Is there something that I can do to make that happen for me? So that's definitely something to think about. And then the next question. So, if you're interested in MD PhD, we can definitely talk more about that in advising sessions as well. You do have to have a lot more research and you have to have kind of like probably in the next couple of years, figured out like the research you're interested in pursuing and what you might be pursuing in an MD PhD program because you'll be looking for PhD programs and faculty that like align with your research goals. So you just have to be more focused on kind of like what you're interested in. It can be any kind of PhD in any kind of field. It just has to be something that you have started to get experience with as an undergrad and then can find programs that align with that in med school. Okay, so I've got questions coming in, so I'm gonna keep answering them and please keep asking them. We have a question about becoming a PA. So PA programs, right? So that's a physician's assistant, are very popular. And we definitely have had a couple students each year now applying to PA programs. They're still very competitive. One of the things I would tell you about PA programs is don't go by the stats that you can Google because it'll say like, oh, all you need is a 3.0 to get into our TOPS PA program. But if you actually look at the people that are getting accepted, that GPA is about a 3.8. So they are competitive, but they're really popular and they're 2-year graduate programs that allow you to practice a pretty high level of care under a physician and a great career. You have a little bit different coursework you need to do, including that anatomy and physiology, and then you do have to have quite a bit more clinical direct patient care work than someone needs going into medical or dental school. So there's actually no like hour requirement for someone going into pre-med or pre-dental. You'll have to list your hours on your application, but they're not expecting you to have an astronomical amount of clinical hours going in. Whereas for PA school, there is a set requirement. It's based on the school, but maybe averages out at like 2,000 hours of direct patient care. And so that can, again, can look like I'm an EMT, I'm a paramedic, I'm a medical assistant. But again, it varies by program. And so you do need to spend quite a bit of time working um, in order to have enough hours to even apply. And, that's because you're going into like a shorter training program. So you have to come in with a lot of experience going into those programs. So hopefully that answers your question. But if you have more specific questions, definitely let me know. Okay. So this slide is really here. It's a great pausing point for our questions, but it's also here just to tell you that like, it's pre-med, pre-dental, pre-PA, those paths we tend to compare ourselves to what our friends are doing. And no two paths look the same. I can tell you that from reading all the applications that come through for med school. Everybody really does something a little differently. And I think that's what makes the process actually really interesting. And as long as you can show your why I want to be a physician assistant, why I want to be a doctor, why I want to be a dentist, then you're on the right track. So try not to compare. Okay. So this may be something that you may or may not have seen. This is again for pre-meds, but can be applied to the other pre-health students that are here on the call today. So these are competencies for pre-med. And so basically the idea here is what medical, dental, PA schools are hoping to see in an applicant. We often get questions like, what am I doing these extracurriculars for? What am I supposed to be getting out of it? So this hopefully will kind of guide you in terms of like what to be looking for in extracurriculars, what you want to get out of it. Like if you're journaling, what am I doing every day? Thinking about, am I gaining any cultural awareness, cultural humility, things like that. And there's actually quite a lot of these. The full list is here with this QR code. You can also, again, Google the AAMC pre-med competencies. But things, again, that they're looking for are someone that's empathetic and compassionate, ethical, right? Has interpersonal skills, communication skills, reliability. So these are all just different things they want you to have before going into a grad school, med school program. And so something you can think about when you're thinking about doing all those extracurriculars throughout your time kind of at Wellesley. Okay, here's your brain. So let's pause again. Questions about that? Oh, here's your PA. Our PA person. Here's your recommendations for clinical work. Okay. So, we're going to make it a little bit more conversational in a minute, so you will have to hopefully talk a little bit. But when you are going to apply for medical, dental, or PA school, they do want you to have good grades, and in most cases, an entrance exam, MCAT, DAT, or PA schools. They're on the fence, but sometimes the GRE, sometimes another test. And then they want you to have extracurriculars, right? They're asking a lot, I know. But they do want you to have these experiences outside the classroom that help you kind of put together that whole person, holistic application. So we tend to put these into three categories, although some of them intersect and overlap, and there is some gray area. But generally speaking, they want you to have research, volunteer work, and then clinical work slash shadowing. So if you haven't started any of these things yet, that's okay. You're only a sophomore, you have plenty of time. And from what I saw in the chat, a lot of you are open to gap time, which is a great time to do some of these things. But we can talk a little bit today about kind of what you're thinking about this year for getting involved in what we call extracurriculars or activities for your med, dental, or PA program. So let's pause there for just a second. So we were supposed to be in person, right? So we were going to do a nice in-person activity, but since we're not in person, we'll just kind of like see if we can do it kind of a Zoom chat. So I just wanted to kind of get from you all what you were thinking about this year for either what you're involved in now for extracurriculars, just to kind of like share with the group what you're doing, or what you're thinking about getting involved in this year. And maybe I'll have Ilham break the ice. Ilham, if you're willing to do that and talk about maybe what you're involved in this year, or if there were other things you were thinking about getting involved in for extracurriculars.
Yes. So, right now I am in a lab on campus in the Science Center. I work in the Darling Lab. So that's like research. And then, um, super unrelated to like, I guess, pre-med stuff. I'm on the equestrian team. And so that's super fun. And it's not like academic at all, but it's a lot of fun and it's a new skill that I started learning last year. Um, and I hope to start getting my clinical hours this year. So, working as an EMT.
Very good. And if anyone has any questions about how Ilham got certified as an EMT, we could talk about that as well. Okay, so who wants to be the brave soul to share kind of like what they've done so far, what they're thinking about for this year? No judgment either. If you just started, love that. Love it.
I can share a little bit, I guess.
Okay, thank you.
But yeah, hi, I'm Michelle. This year I'm doing for orgs and stuff. I'm doing like BC squared and like Chem Society, and
Nice.
I'm really excited for like the outreach events that we'll be planning. So that's really cool.
Very
I'm
cool.
also on math. So I'm a treasurer, so I'm really excited for that and all the fun events we're doing.
Nice.
And this year, I would really like to get more involved with like volunteering and like also like maybe start thinking about like clinical hours as well.
Yep.
But yeah,
Great. Do you have any like events that you're planning that you want to tell us about? Just is there anything yet, or are they all in the works?
it's in the works, but we just had our like open meeting and we made really cute door tags.
So
Yeah.
fun. Great.
Yes. So
So
yeah.
awesome. Love it, love it. So what are you thinking about like when you think about clinical work, what's interesting to you? Do you think about like, oh, maybe I'll get a certification, or is it more like you want to do shadowing, or what are you interested in?
So I think shadowing's interesting,
Mm-hmm.
but I'd also really like to like maybe get a certification or like I like was kind of considering like medical scribing or
Yeah.
something like that.
Yeah. Mm-hmm. Very
So
cool.
yeah. But yeah,
Yep.
I'll keep my options open for now,
Yep.
I think.
Yes,
Yeah.
medical scribing we didn't talk about yet, but that one is a great example of something that you can do where you kind of like follow around the doctor and take notes, right? Someday that might be taken away by AI, so get it in now. But yeah, those jobs you don't need as much training for either, so it's a little bit of a easier lift at the beginning. But yeah, that's all really great. And the clubs and orgs are awesome. Sometimes you could do volunteer work with your clubs and orgs, it depends. And sometimes I know you kind of have to
Mm.
go outside of that. But I know if you're interested in getting your like club org into doing some volunteer work, you can work with civic engagement on campus. Elham, you did that a little bit, right? Because they have vans. Do you want to speak to that a little bit?
Yeah, I was just about to put something in the chat. So, you can work with civic engagement to get vans, and then there are two orgs that come to mind that do like basically like exclusively clinical volunteering. I'm thinking of Alzheimer's Buddies because I just got an email about an open meeting tomorrow.
Mhm.
Um, so if you're interested in that or interest meeting tomorrow, and then there's also Boston Healthcare for the Homeless, and I think there's also Boston Children's Hospitals. I haven't done that one, but transportation is covered, and you just volunteer. It's a lot of fun.
Cool. And I'll put the link to the civic engagement office. They also have like volunteer opportunities every once in a while where you can do like a day of service or something like that to start getting involved with community service. All sounds great. Cool. All right. Who else wants to kind of talk about what they've done slash what they kind of are thinking about doing this year?
I can go.
Okay.
Oh, sorry. Yeah, hi, my name is Mega. And this year on campus, I'm involved with Wellesley for Public Health. Um, and we're in New Org, so that's very exciting stuff. And then I'm also involved in Period, and I'm also in ASC, which has been very fun. And then I also am continuing some research I did over summer, and it's like data science and public health related. So yeah. And then in terms of what I want to continue or like get more into this year, I did OWL studies last year, and I'd love to continue that stuff and like get more patient interaction or clinical hours. And I was also thinking of doing medical scribing. But yeah.
Awesome. Yeah, that's great. Yeah, so the public health org is new. Do you want to give anybody that's interested in like public health a little like I'm putting you on the spot again, but any like thing about that org that they might be interested or if they're interested in public health?
Yeah, sure. So our, like the public health org, we're kind of focused on like giving career-based and education-based experiences into like public health. So we have some of our upcoming events include like Wellesley alums who are in public health programs, like MPH programs right now, coming and talking about the different concentrations they're doing and what that entails. And then we're also trying to have like lectures with faculty like from different schools in the Boston area who are involved with public health as well. And our theme this year is Indigenous traditional medicine. So a lot of the events we're doing are like related to that. But yeah,
Ooh, I like that you have a theme. That's fun. So are you a good person to contact if they have more questions or just
yeah, you can totally contact me. My email is mr133.
MR133? Cool.
Mm.
I know we have had a lot of public health interest, obviously, since you guys started an org. Great. So perfect. So yeah, that all sounds great. Um, I was going to share with you two things. So, a couple of you mentioned shadowing. Sometimes shadowing can be hard to find. And Ilham, if you have anything to add on this. So, usually we say, okay, with shadowing, first thing, think about exhausting all of your personal contacts. So, that's your first step. So, no matter where you're from, think about like, okay, do I have a pediatrician at home? Do my parents know any doctors? Can I think about personal connections? The reason that that can be helpful is because it sometimes can be hard to get into an office for shadowing just based on logistics, paperwork, they're busy, so just having like a little in, I know this person type of thing, can be helpful. Now we know that's not the case for everyone, so certainly not everyone's going to know someone. You can definitely cold call, cold email offices. I've seen people get success that way. I would suggest that if you are thinking about just like kind of the reaching out strategy to stick with smaller offices because if you're not already associated with a hospital or a big medical care medical system, then sometimes they will know you right away because you have to do a bunch of paperwork, have these vaccines, have these things, and for someone to shadow, it might not be worth it for them. So sticking with like a smaller clinic, you could look up in Wellesley or Natick or something like that might make more sense. What was I going to say? The other thing that happens that I think people get worried and then shadowing just kind of like naturally happens and the way that that can take place is like let's say you get a research position or you are working as a medical assistant or something like that where you are already into a healthcare system or in a clinic or at a medical school where you're working with people and then you meet a doctor there and you say, "Can I shadow you?" And now you're already in, and they say, "Yes, of course," right? I had a student who was volunteering at Boston Children's Hospital, which like no one ever shadows there because it's really hard to get into shadow. But once they were in, the doctor was like, "Oh yeah, you already are like have everything in our system. You're like safe to be here, good to go. Like you can shadow with me." So sometimes it will happen later when you're involved in something different, if that makes sense. And so again, we can have more conversations about that if you want. But two things I'll share with you. One, there is a Wellesley in Medicine Facebook group with alums that I just put in the chat. I know some people don't have Facebook, so no worries if not. But if you happen to have Facebook for the groups, because why else do you have Facebook? Just kidding. That's why I have Facebook. But this is a group of alums, and there's also they have like a database they share with you when you join, and it has like a bunch of alum contacts. I don't know how active it is because I'm not in it, but anybody in that group that's been able to see, I know there's a lot of people on it as far as the activity. you got to go on to know. But you have to fill out like the little form to say you're a Wellesley alum. And I have seen the database that they have of Wellesley doctors around the country, and it's comprehensive. There's lots and lots of doctors to connect with. So that's another way to kind of at least get your foot in the door or be talking with some alums. And then if you may have heard of this, but if you're interested in pediatric care, there is a family-owned clinic in Arlington, which would have to figure out how to get to there. But it's called Purple Crayon Pediatrics, and the head and owner, the doctor, is a Wellesley alum, and then there's another Wellesley alum that works there, and they love our students. They love to have our students scribe there, um, shadow there, so on and so forth. So they have to have obviously space because it's a small clinic. But if you're interested in pediatrics, it's worth reaching out to them, and they definitely know and expect, us to send people their way. So there's a couple little tidbits for you to kind of get you started if that's helpful. I have one more thing I wanted to talk about, but before that, I've kind of heard mentioned. Before I do, I'd love to have someone else share. I think there was someone that was gonna maybe kind of talk about their extracurriculars. Anybody?
I guess I can go.
Thanks, Taylor.
I guess this year I'm excited to continue volunteering with Alzheimer's Buddies and Boston Healthcare for the Homeless. Um, and then I'm also being a chem TA this chem lab TA this semester, which I'm excited about. And I'm also like I'm part of the bees like run club and like the climbing club. So like I like promoting like a healthy, balanced lifestyle.
That's awesome. For people that don't know about the bees, can you talk about that real quick? And then do you know like when's their hiring cycle for new people to be in the bees and she's, do you know?
Yeah, so the bees are actually one of the for peer health or organizations on Wellesley. We focus on like overall like balance. Our four principles are nutrition, exercise, sleep, and stress resiliency. And we actually have an open meeting for all interested members tomorrow at 6 in the Science Center. Anyone can come, and it's like there'll be like a training sometime like end of this month, October, for a day, and then it's like you're a member and you can come to like meetings once a week and just like different like wellness events that we put on.
Yeah, thank you. Yeah, I asked you to kind of explain it because that's an awesome thing that I see on applications sometimes because you're able to like provide health education and information to your peers. So similar to, what you're going to do later on in a career. So that's really good experience to have on your application. So if anyone's interested in that, we don't know what room in the Science Center tomorrow night at 6, but you can walk around the Science Center till you see someone.
Oh, it is. Oh, it's L35 or
Awesome.
the whatever the floor is 35, I think. I think it's L35.
Thank you. Very helpful. This is why I wanted you all to share. You all the best. Okay, so hopefully you're kind of seeing that everybody's doing a little bit of everything. And the tutor TA work is great too. So I know some people mentioned that. That really is a great thing to have on your application. One thing we haven't talked a lot about that I'm hoping someone will speak up on is if anyone's doing research. For those that haven't started research yet, what would be like a first step to getting a research position? So I guess let me have Ilham start with how she got a position on campus, and then maybe if someone's doing a Europe or somebody was doing public health research, maybe you can talk about how you got that research research position as well. So we'll start with Ilham.
Yeah, so I got involved with the Darling Lab through the sophomore early research program. And the process for that was very similar to how you would get involved in any lab on campus. And it's literally just reaching out to the professor, and if they have space, usually they'll say yes.
Okay, so getting good with your professor. Love it. Anybody doing a Europe? So that's the MIT Europs? No. So that's another a popular avenue for people to find research positions, like if you can't find one on campus or if there's more interesting research to you at MIT. You can look at UROPS online. You just have to have an MIT login to see the different ones that are available at a specific time. So if you haven't taken a class at MIT to have a login, I have heard you can browse on your friend's MIT login, because from there you just kind of like reach out to faculty. But that's another option. And then I'm sorry that I forget. Was it Michelle or someone who was doing public health research? Remember? Okay, who on this call is doing research, and then can you share? How about that? Any kind of research.
Wait, I was gonna. Oh, sorry. Did I interrupt someone?
You can go first, and then we'll have Natalie tell us what she was gonna say.
Oh, okay. Well, I was gonna chime in when you asked about the Europe, and then I like
Oh,
think I missed the timing.
oh, sorry. It's Zoom timing.
No,
That's the
that
problem. Okay, go ahead.
okay. But yeah, I'm doing it. I'm continuing my Europe from like the summer where I was working in a lab doing like neuroscience research. And yeah, I think it's like a similar process. Like I cross-registered at MIT for a course first, and then I got to like look through the browser and like look for different projects. And they have like a really wide variety of like computer science and like biology, chemistry. Like they have a lot of different projects on the browser. And yeah, so like I just emailed the whoever's like the contact email is on the Europe browser and like scheduled an interview, filled out like the forms and everything. So yeah.
That's awesome. Did you have to did you apply to more than one lab, or were you focused in on just the one?
I emailed a couple different labs whose like research sounded interesting to me, but I ultimately like stayed with this one. So yeah.
Nice. That sounds awesome. Good. Thank you. And then Natalie, did you
Yeah.
say something?
Yeah, I did research over the summer here and I like continued with that lab into the school year. So I'm just looking at like horizontal gene transfer in like it's just like oceanic microbiome. Yeah.
Love it. And how'd you get it? Like, how'd you first get it?
Yeah, so I just applied through like the summer research program. I think I don't remember when, but I think it was like in spring semester at some point. Yeah.
Awesome. Good. Thank you for sharing. So if you haven't had a chance to get involved in research, hopefully that gives you a couple ideas. And I know I mentioned this earlier, but it doesn't have to be any type of research. It can be in any interest area that you have. And sometimes people will ask me, like, they'll be in one lab and they'll say, okay, like, I've gotten good research experience, but like, this isn't my passion area for research. Is it okay to switch labs? And absolutely, in that case, if you want to try a different area of research, it makes a lot of sense to switch. Certainly, like on your applications, you want to show like a commitment to research or a job. So being there for a semester, a year is great. Of course, there's circumstances where you may not want to stay that long, but usually you want to like commit to like a semester, a year or more. But if it's a lab you're not interested in, certainly pivoting, like again, that's totally fine. Good. So, um, I'll pause right here. I know Zoom is like the place of awkward pauses, so please excuse my awkward pauses. But I want to leave it here for to open up for questions. So I'll just be quiet for a second, and if you have any questions in um you can put them in the chat or ask out loud. Yeah. And then while you think about any questions, I'm gonna just pull the presentation up and back up one more time.
Hi, it's me
Hi.
again. I am like interested in medical school and I feel like it's obviously like kind of a long process. Like you have to be like kind of intentional about the steps you take. But I was just like wondering like maybe other than like volunteering, is like, do you have any advice for like how I can kind of figure out like, oh, is this like the path for me kind of
Mhm.
thing?
Yeah,
Yeah.
it's definitely a long
Loaded question,
process.
but yeah.
Yeah. Yeah. So if you're still kind of deciding, I think we can, obviously like chat, we can chat one-on-one too, or but one of the things we suggest you do in the beginning or while you're deciding is to see if you can do some shadowing or chatting with folks that are in the field. I think that can be most helpful in deciding if it's the right path for you because you can ask questions like, what do you like about being a physician? What do you don't like about being physician and kind of thinking through like if it makes sense for you. Certainly it doesn't make sense for everyone. I think, you really have to be committed because of the length of the commitment. That's why I think it's important to talk to people in the field. So that's one of the things you can do. Doing other programs like Harvard Meds or Upskill, which is Harvard Med Science, where you can actually like go to a med school, try some of this hands-on stuff, see if this is something like you like or don't like. That things like that can be helpful as well. And then talking to your peers like you're talking to today, or we will have alum panels. So um, we have a health professions week in March, like the first week of March. So if anybody did it last year, it's like a week of events. And one of the things that we have is usually an alum panel. So we'll have either med students or like just out of medical school, physicians and other healthcare providers come back and kind of like talk to you all about their experience. And you could just like ask questions. So, kind of picking their brain about like why they chose it, if the path made sense for them, things like that. Um, so that's basically like getting involved in as many like hands-on programs as you can to try to like feel out if it makes sense for you. The other thing you can do is like process of elimination. So if you're involved in research right now, if you end up really just like falling in love with that research, maybe you go that route and go a route of working or PhD over like the MD. So it's really about like kind of trying different things and having different experiences to try to kind of get you to the point of deciding. But I'm happy to like have a longer conversation about like kind of your specific reservations and like what's kind of going you through your head as well. If you want to do a one-on-one advising appointment. I will tell you right now I'm pretty booked and Cindy's pretty booked, but well, I'll slow down. We get booked in the beginning because everybody comes back and gets excited. The other thing you can do is shoot me an email and I can squeeze you in. But um, but yeah, it's not an easy decision. So I think going to as many programs as possible to try to figure that out, I think is a good idea. Other things you can think about is like for med school and dental school, you have to take the big entrance exams. Specifically for medical school, you have to take the MCAT, which is an 8-hour intense test. So if that sounds like the worst day of your life and you definitely don't want to do the MCAT, that would be a good reason to not go to medical school. So things like that you can kind of think about. Also cost. Um, so cost of medical school is high. Some medical schools have funding, some don't. And now they're putting caps on federal loans that you can take out for these programs, which makes it a little bit harder for people that can't pay straight out. So cost is certainly another consideration as well. So yeah, lots of things to think about and contemplate. But again, happy to chat more for sure. Hopefully that helps a little.
Yeah, okay, thank you so much.
You're welcome. Okay, so study abroad, which is a great question we have in the chat because we didn't talk about it. Okay, so study abroad, when should you study abroad? So that's actually, so if you're open to taking gap time, you can study abroad whenever you want, really, because it's not going to impact too much of your schedule. Most people study abroad in their junior year. Perfect. You can't take pre-med requirements abroad, so keep that in mind. You can take other classes and have a wonderful time. And we encourage you to study abroad, but just don't take any of your like official pre-med requirements. Um, if you want to take just one gap year, it can be a little trickier because then you're applying in your senior year. And so you have to think about timing. So probably don't want to study abroad in your senior year if you're going to just take one gap year. Because you have to take the MCAT, you have to do all your application stuff, which can be a little bit harder abroad. Not impossible, but harder. Um, So yeah, so if you're open to 2 gap years, then it's really you can study abroad at any time that fits in your schedule. Um, Good question. Other questions that are coming up. Please feel free to ask. I'm just going to share with you the screen one more time. Maybe if I can figure it out. So we do have the experiential learning browser now. Can you all see that? My screen. I can't see Ilham, so tell me if you can't see it. Um, so you are eligible for a lot of the career education internships this summer. And so this is the browser, this links to the browser, and there's a lot of career education placements that are not a lot, some that are pre-med, pre-health related that you could apply to. And so this is a screenshot, but you could search for those on this browser. And it's usually sophomore or juniors that are eligible for those. And the application comes up fast. It's usually due in November. So you have to apply for those pretty early. And that would be like a paid summer internship. Has anyone, probably not. You didn't do one of those, Ilham, did you? No, no. So if you start thinking about this summer, you can think about applying to some of those by searching this page. You can also, we have a big database for pre-med. I don't think I have it linked for pre-med students. Right here. Um, and I'll put this in the chat. This was made by a student. I don't, at this point, some of them might have lost funding, so I'll just say that. So you just kind of have to do a little bit of deep diving. But there are quite a few summer opportunities for pre-med, pre-health students, potentially pre-dental, pre-PA as well. Ilham, do you want to talk about what you did? Did you do one of these structured ones, or was yours was more unstructured for your summer internship?
I did a structured program. I did one at both summers. I was at WashU Med through the Opportunities in Genomics Research Program, which
Mhm.
is very similar to like other research summer experiences at big schools.
Yeah. And it was paid, or did you get housing?
Yeah, it was paid. We got a stipend, and then they also covered housing and transportation.
Awesome.
Yeah.
So as you start planning out like kind of your summer, if you haven't thought about what you want to do, you could look into internships. So your first year, not a lot of internships available for you in the summer. This year, probably a couple more. So me and Ilham can help you do like a search for internships. We can also help you with application materials. So let us know if you have any questions about that. And then the slides kind of continue. We're running out of time, but there's just a couple more slides on resources. So just to know that there's some ideas of volunteer sites as well as this Boston Cares calendar, which is I think is really interesting. It's more of like a starting point. If you go to the calendar, it'll tell you every single day something you can do to volunteer in Boston. But like if you're not sure, it's a great place to like look at like what's out there and do a one-time volunteer project, and then maybe you can connect with people to get more involved. So I just think it's a nice starting point as well. There's some information on shadowing. Um, and this talks a little bit about letters of recommendation. So for some internships, you'll need letters of recommendation, and then definitely for medical, dental, and PA school, you need letters of recommendation. And you're probably like, why are you telling me that in my sophomore year? I have plenty of time. Um, this is an important piece to know now because it's good to start building relationships with folks that you think you may someday ask for a letter of rec, right? So um, going to faculty office hours, connecting with faculty for research, or really anything, just so you feel confident when it comes time to kind of have to ask people for letters of recommendation. I'm not going to go over all of these sides, but and then there's some acceptance data info. So some people love data, so you can kind of see from the 2025 cycle how Wellesley students did in the application process to med and dental. Our students do really, really well. We typically have like 100% dental acceptance rate. So woohoo to the dental student on the call. And then a really good stats for med school as well and PA school as well. So far, in my brain, we have 100% of the students I know that have applied for PA school. And then people go all over the country. So it's really common to apply to your state of residence, but people really go everywhere. Lots in New England. And then just some pictures because they're fun. White coat pictures of people that have recently gone into med school. All right. Any additional questions right now?